Natural immunity is, again, the data is still sort of coming in, but appears to be less protective than the vaccine. So, if you had COVID, you are more likely to get a second infection with COVID than sort of the breakthrough category of those who are vaccinated. And the protection against severe disease, again, appears to be stronger with the vaccine. The vaccine is specifically designed to really ramp up the immune response. It appears that the immune response for natural infection is highly variable. So you could be fine. You could be one of those people who their immune system really got it right. They had a rapid ramp up of all the different types of immunity that you can develop, but that's kind of a roll of the dice. The majority of people are better protected following the vaccine than a natural infection. Now, if you do both, you end up with really, really good data that you have both long-lasting and strong protection. So myself as an example, again, the fact that I have both had a vaccine and had a natural infection likely means that I've got longer lasting protection going forward. I certainly don't want to put that to the test. I still wear a mask. I still follow all of the rules and guidance. But those who have previously had COVID-19, the absolute recommendation is still to get the vaccine. If you want to talk about sort of what a booster does, this is kind of like a super booster, right? You have some level of immunity perhaps after a natural infection. Getting vaccinated on top of that gives you a much, much higher degree of protection. So the strong recommendation is for those who've had a natural infection to still get vaccinated. And that said, the people who are at most risk are those who are completely unvaccinated because they don't know how they'll respond. One of the weird things about COVID-19 is it's very difficult to predict how people who are infected are going to respond. Those with comorbidities and other illnesses clearly do worse in aggregate, but for any individual person, you really just don't know who's going to have a really rocky course and who's going to be fine. So if you're unvaccinated, you're absolutely better off developing that immune response and developing that protection. So to talk to the second point around what is EUA, how are these vaccines developed? Emergency use authorization is a way for them to grant early access to a promising drug, right, or promising therapy, in this case, the vaccines. But to get that authorization, it's really important to understand the process and that no steps in that process were skipped, right? So if you think about how a vaccine normally goes from concept to market, the testing involved requires sort of two things. You need a whole bunch of volunteers, and you need for some people in that volunteer group to have the illness you're trying to protect against, right? So if you get 1,000 people to sign up for your study, but the background rate of infection is 1 in 5,000, you don't know whether your intervention caused 0 cases because it's a great intervention, or whether your intervention caused 0 cases because you simply didn't enroll enough people in your trial. So generally, when you do a trial for a vaccine where the background prevalence or the amount that it's around in the community is low, you have to enroll a lot of people. And it takes you a long time to do it because you have to get people who fall into the right category, may or may not have the illness, and then follow them until you see whether your intervention prevented whatever it is you're trying to prevent, either long-term or severe symptoms or prevent the infection itself, et cetera. So the reason they were able to get EUA so quickly for the Pfizer and Moderna and J&J vaccines is because, unfortunately, COVID was everywhere. And so, number one, it was really, really easy to enroll people in their trials. They were able to accrue the 30,000 plus volunteers that you need immediately. And within that population, there was a large prevalence of the disease. Remember, at one point when we were testing people, coming off the street, 25% of people had COVID. It was everywhere. And so you were able to get the data that you needed very, very quickly. You could get enough information to show any statistician, this is what's happening, this is what's not happening, right? Like, you guys do math better than I do. You know how the modeling works, right? I'm not going to sort of try to give this audience a stats course, but the data was there, and you were able to get to the data very quickly. And then you could take that to the government and say, look, not only is this safe, right? That's the first step of any vaccine trial. Show that it's safe, right? Treat a bunch of people with it. Nobody has a bad outcome. Number one, it's safe. Then you treat a whole bunch more people with it and say, does it actually do anything, right? Does it prevent whatever we're trying to prevent or change whatever we're trying to change? And that second piece is where you need a very, very large pool of people, which they were able to enroll very, very quickly. And they were able to show very quickly how effective it was, because it happened to be a fantastic intervention, right? Those vaccines showed effectiveness very quickly because they worked really well. So you were able to get to the data that you needed in a much shorter period of time than if you're trying to, for instance, create a vaccine against, a rare childhood cancer. It's going to take a really, really long time to show that that works. It may take a decade to get enough data because it's just not that common, and you don't have that many people who can enroll in the trial because they're not appropriate. So they were able to get to EUA very quickly because, unfortunately, if you're trying to run a trial, doing it in the midst of a pandemic allows you to get to the statistics you need very, very quickly. So that's why they were able to be granted EUA. The final stages of removing the emergency part of it are underway for all 3 vaccines and will likely be granted very soon. Again, the data is overwhelming. The numbers are very clear. There's no ambiguity about that. It's safe and it's effective. So right now it's kind of just going through the red tape. Nothing is going to change. These vaccines will be fully approved whenever the sort of bureaucratic process runs its course. There's no more data needed for it, right? It's not like they're still trying to run trials for the EUA removal. At this point, it's just the bureaucratic process that will be removed when it's, runs that process. They are still running trials on under 12 years old. They're gathering data on, other sort of subsets and things of interest. But right now, the EUA data is essentially all in, right? We have the information that we need. The data is there. It's safe and effective. So that title, I think, causes a lot of confusion. People may not necessarily know what that means. It's just a bureaucratic shortcut to get this out into the market sooner to help people. The data is overwhelmingly clear. Nothing's going to change about the vaccine. Nothing's going to change about its effectiveness. The title that the government gives it is going to change whenever it runs that process.